Hi, everybody. It's Vanessa Meyer with Dr. Natalia Pellegrino, and we're here for your wellness tip of the week. Happy everything. Today, we're going to talk about one of my favorites and least favorites, and I'll explain why. You'll find out. We're going to talk about contrast showers. Woohoo! It's a very simple technique you can do at home to promote healthy circulation and immunity. It's totally free. How wonderful. And it's easy to add to your daily routine. That's right. We're talking about contrast showers, and you're going to find out while it's not appealing, but it is. After you learn about the amazing benefits of the simple technique, you're going to want to try it for yourself.
For sure. I love this technique. I tell all my patients to do it, and they don't love to hear that. But when I tell them like how many amazing things it does, then they're on board. And we'll tell you how to ease into it as well. So one of the main, probably the top thing that it's doing is it's boosting your circulation. So the contrast between the hot and cold water basically creates a pumping action. So you have your heart that of course is pumping your blood, but this cold and hot enhances the effect. So the warm water causes your blood vessels to expand, which brings all the blood closer to the surface, further out to the extremities. And then the cold water causes vasoconstriction. So your blood vessels contract, driving blood deeper to the core of your body and into your organs. So this is essentially refreshing your circulation, enhances detoxification, lymphatic drainage. So it's just kind of like bringing everything back to the heart and lymphatic channels to recycle it. And one of the other huge benefits is that it boosts immunity. So this has been shown to help prevent and fight off common illnesses like colds and flu. And it has been studied to show that the contrast actually increases the number of circulating white blood cells among other immune cells. So that's pretty cool.
It is pretty cool. One of the major benefits too is that it decreases pain, swelling, and inflammation. So you have the hot water bringing fresh circulation and nutrients to the damaged areas. And then the cold water removes the waste products and then reduces the swelling by flushing out all the fluid back to the heart and the lymphatic ducts in the chest. So one of my favorite things that it does is if you have a hard workout or you've been moving things or whatever, it prevents delayed onset muscle soreness, so also known as DOMS. So if you're a hard worker and your body is tired, this is the best way to get around that 2-day lag of, oh my gosh, I can't move and I don't feel good, right? It helps with post-injury recovery like strains and sprains. God forbid you've had a fall or you've hurt your ankle or anything like that. This is the type of bathing that you want to do. It also helps with chronic pain syndromes like joint pain, headaches, migraines, fibromyalgia, and so much more. I've had plenty of clients come to me with so many aches and pains, and this is one of the techniques that I usually tell them to do. It's very, very energizing. So because it can help you feel so much more alert, you might not want to do it right before bedtime, although I've done it and I've been fine, but some people get too stimulated. For me, if I'm tired, I'm tired, and that's it. But yeah, you might want to do it earlier, and maybe you'd extend the amount of time for your cold, but we'll talk about that in the next part of it.
Yeah, it's good to know. One of the other benefits is that it can actually help with weight loss because the cold exposure stimulates what's called adaptive thermogenesis. So it's kind of forcing your body to respond to the cold by producing more heat. So it's trying to warm you up. So that increases your metabolism, even if it's just slight. So we want some of that benefit for sure. And another benefit that has been studied is that it boosts your mood and can also help with depression. So the cold exposure actually increases blood levels of mood boosting neurotransmitters like your endorphins and adrenaline, so all the feel good neurotransmitters. And in general, it sounds counterintuitive, but it actually helps to calm your nervous system in the end. So first, the cold kind of stimulates more like fight or flight mode. So it feels like, a little bit of a shock, but then your calming parasympathetic nervous system, so this is your rest and digest nervous system, comes in and compensates for that. So it kind of like helps to bring you down. So for people who are under stress and, high cortisol, things like that, this is one of my top recommendations. It's so simple and so effective. So how do you actually do it?
That's a
Vanessa?
great question, Dr. Pellegrino. So as you know, we're great friends, and I just want to put a side note in that when I was sick in October, she said, "You better be taking your contrast showers." And I was like, "No, I don't want to." But it helps, obviously. And so that's why we have to do this little wellness tip for you all, because it does work. So here's the how-to. So you're going to get into your shower. You can make it warm or hot. I usually tell people not to take really hot showers in general. But if you do, you kind of just want to fluctuate your temperature, because too hot for too long starts to make everything actually kind of yucky in a sense. But you can chill it down and then slowly go into a cold water for about 1 minute. And that's how you're going to start. You'll start with 1 minute only, and having that endpoint in your mind also calms you down. So you know you're not going to stay there freezing your tush off. You'll be able to warm it back up. And again, when I say gradually, I'm not saying like take 5 minutes to get to your hot temperature. No, you're talking about like it should take about 15 seconds to just warm it up, and then you'll have that contrast, because we are looking for warm enough and then cool enough. Okay. When you get into the colder water, this is your opportunity to do your slow or quicker breathing, and you can check that out, how that feels. You might notice that a quicker breath might feel too stimulating for you, and you might panic a little bit, or it might get you really amped up. You can see that maybe the slower breath is for you. So I don't tell people which one to do. I just want you to try it and explore what works for you. Okay. Then you do the cycle about 3 to 5 times, and that's the end of your shower. It should take about 15 to 20 minutes. And you finish off with the cold water that provides a quick vasoconstriction in the superficial blood vessels, and your body will adapt by warming up afterwards. The other benefit of actually finishing with the colder is that when you get out, you're not freezing your butt off again. So you're already there, and then anything you do after that is going to feel really super cozy and comfy. To maximize effect of the contrast shower, like I said before, you want to make sure that there's a large difference in the temperature as much as possible, and the hot portions of the shower should last longer than the cold portions.
Yeah, that's great. So we should all be doing this. And I also wanted to mention that just to ease into it a little bit, it can be a gradual transition. So you don't have to just become one of the polar bears overnight, where you're doing the cold plunge into the Atlantic. You can just start with cool water, especially if you're older, you have other health conditions. You just want to be a little bit careful. And I'll talk a little bit more about the precautions, but you'll adapt. You do this every day, you'll start to adapt. And before you know it, you'll be switching all the way to freezing water, and it's going to feel amazing. Trust me. So a couple of precautions. You definitely want to be careful with major heart conditions like congestive heart failure. Any sudden changes to the body temp and heart can overwhelm the body. So just thinking about, this is literally pumping, forcing your heart to work harder. So if you have any underlying heart conditions or high risk for cardiovascular issues, you want to be careful. You want to be cautious with open wounds, of course, like post-surgically. I think eventually, once there's enough healing and you've been, approved to get the area wet again, once there's enough healing, this could be great, but you want to allow that healing first. Cancer, you want to be extra careful. Pregnancy, you also don't want to super shock the body during pregnancy, but you can also do just more of like a gradual, sort of gentle approach. So cool water, not freezing, but also other conditions like multiple sclerosis, because you might be more sensitive to heat and that, circulatory contrast. But just circulatory disorders in general, peripheral vascular disease, where there's plaque in the arteries and pain when you're promoting circulation to the legs. You want to avoid that. And also with diabetes and neuropathy, just because there's potentially reduced sensation. So you just want to be able to feel what you're doing. So those are the precautions, and yeah, so that sums it up. And I hope that you'll try the cold showers and send us a comment on how you feel when you do it. So that's our tip of the week. And anything else you want to add to that, Vanessa?
No, just don't be afraid to try these things, and have some fun with it, because it is going to make you feel probably a lot better. So just take note of how you feel after a contrast shower, and then you can start to include maybe a little bit more cryotherapy techniques. And well, we might be talking more about that in the future as well. Although there's so many different parts of it. So this is just your beginner note to contrast showers and boosting your immunity and feeling all your circulation work for your benefit. So happy wellness tip of the week.
Take care, everyone. Hope you try it, and we'll talk to you soon.